Queensland authorities say they're not concerned about widespread disruption in the hospital system after the suspension of thousands of health workers who have not been vaccinated against COVID-19. More than 7,000 staff are yet to confirm their vaccination status, with about 4,000 to receive show cause notices and be suspended on full pay. Dr. Maria Bolton is from the Australian Medical Association of Queensland. She joins me now from Brisbane. Dr. Bolton, thank you so much for your time. Why aren't these healthcare workers vaccinated?
It's human nature. I think that some people, there may be a little bit of vaccine hesitancy. Some people may be sitting on the fence waiting to see what happens. And it's just a little bit frustrating because we have had the vaccine freely available for some time now, and we know that our borders are going to be open soon. So I implore for people to, if they have concerns, to speak to their GPs because the vaccines are safe.
What does it do to a health system which is already under pressure?
Yeah, so the Queensland Health, the hospitals are already under stress, and this is going to stress them out a little bit more. However, to have unvaccinated healthcare workers contract COVID would be much, much more disruptive, because then that means that other staff members will have to be quarantined, wards would have to be closed, and it would be much, much more disruptive to patient care.
Do you know, out of the 4,000 who have been stood down on full pay, how many of them are, say, on maternity leave or long service leave, or how many of them are actually just against being vaccinated?
Yeah, I'm not sure, Karina, because I don't have those figures. I expect that there will be a small amount that would be vaccine hesitant. That's what we see normally in the community. But I can't comment on exact figures because I don't have them.
How much of a contributing factor is vaccine hesitancy? Because in June you had the former Queensland Chief Health Officer, Jeanette Young, make comments about AstraZeneca, that she didn't want young people taking it. How much of that has contributed to people being hesitant against vaccines in Queensland?
I think there's been a lot of factors that have contributed to vaccine hesitancy. I think you're right, the mixed messaging hasn't helped. Also, initially in the rollout, there was poor access to some of the vaccines, especially regionally. But access has improved. There's lots of vaccines around. There's 3 brands that people can access. And I think that now that we're looking at the borders opening in 6.5 weeks, there's still a chance for people to get vaccinated. And, you know, I'm a GP and I'm always happy to have the conversation with someone. And what we've seen with the deadline is that a lot of people that were sitting on the fence are now presenting and having that conversation about the vaccine, and it's really good to see.
Yeah, that's a real positive. How are the vaccine rates looking ahead of that border reopening on December 17? The Courier Mail is reporting that about 1 million Queenslanders will remain unvaccinated by that date.
Yeah, I don't think we'll be at 80% by that date. At the moment, I think we're just over 70% of first doses. And I mean, it would be great to get to 80%. It would be even better to get to 90%. I do believe we can get to 90% because when you look at all the childhood immunisation rates, more than 90% of children are vaccinated. So I have all confidence that we'll get there. Maybe it'll be in January. It'll just depend what people will do now when they've got a short time before the borders open.
Yeah, go and get vaccinated. Dr. Maria Bolton, thank you so much for your time.
Thank you.